Renal tubular acidosis. From Enjoy Medical Mnemonics. We have 4 types of renal tubular acidosis. Type 1, distal type. Type 2, proximal type. Type 3, combined type. Type 4, hyperkalemic type. Type 1, distal renal tubular acidosis. In this type, there is inability of distal tubules to discharge or secrete hydrogen ion. We will take the first letter of each type to remember the clinical feature of this type, so we will take the letter D to remember distal type. D4. Distal tubules is the site of defect. Discharge or secrete hydrogen ion defect. Deposition of calcium risk is increased, so nephrocalcinosis is a feature. Demineralization of bones occurs. This result in rickets in children and osteomalacia in adults. Defect in immunity. Autoimmune disease is the most common cause in adults. Type 2, proximal renal tubular acidosis. In this type, there is bicarbonate reabsorption defect in proximal tubules. We will take the letter P to remember the proximal type. P4. Proximal tubules defect. Proximal in age as it is usually occurs in infancy. Bicarbonate reabsorption defect also remember that bi equals 2 so bicarbonate equals type 2. Below others in height, so stunted growth is a prominent feature in children's. Type 3, combined renal tubular acidosis. We will take the letter C, first letter, in the type name to remember it. C4. Combined means proximal and distal. Carbonic anhydrase 2 deficiency. Cerebral calcification. Mutation in the gene encoding for carbonic anhydrase enzyme gives rise to renal tubular acidosis, mental retardation, osteoporosis and cerebral calcification. Chromosome 8q22 is the site of mutation. Type 4, hyperkalemic renal tubular acidosis. We will take the letter H, first letter in the type name to remember it, but we will not use only one H, but we will use for H to also remember that it is type 4. H4. Hyperkalemia. High sodium excretion in urine. Hypoaldosteronism. Hyporeninemic. Management. We will take the letters R, T, A to remember the management. R for related electrolyte management such as potassium, calcium, and phosphate. T for type as management varies by type. Letter A for alkali therapy such as sodium bicarbonate, potassium bicarbonate and sodium citrate. Summary.
Thank you.